Morning. I'm Dr. SOWJANYA and I'm going to present the paper about a study on ocular manifestations in orbital wall fractures. No financial conflicts of interest to disclose. Orbital wall fractures are seen in a significant number of patients presenting to hospital with blunt trauma to the orbit, which can be limited to the orbital cavity alone or associated with complex fractures of other facial bones. And they can be seen in various modes of injuries such as road traffic accidents, assault, self-fall, sports injuries. And serious complications that are associated with orbital wall fractures include muscle entrapment, traumatic cataract, subluxation, dislocation of lens, sclerocorneal tear, ruptured globe malposition, an optic nerve injury which can be direct or indirect. Functional impairment and aesthetic deformity are the long-term sequelae of orbital wall fractures which should be kept in mind for the treating ophthalmic surgeon. The aims and objectives of my study are to study the etiology of orbital wall fractures and common ocular features associated with reduced visual outcome and early intervention to improve the visual prognosis. Inclusion criteria were all orbital wall injury patients proven radiologically coming to the ophthalmology OPD and emergency room, all modes of injuries, both female and male patients, all age groups, and unilateral and bilateral cases. Exclusion criteria are previous history of any head and ocular injury, patient not willing for radiological examination, congenital ocular and orbital anomalies, and uncooperative, disoriented, unconscious, and comatose patients. The methods were, it was a prospective study of 40 cases of orbital wall fractures conducted at Department of Ophthalmology, Kakinada, over a period of 1 year from August 2022 to May 2023. All cases with CT scan or radiological evidence of orbital wall fractures were included and a detailed ocular examination findings noted. The CT scan findings which we included were documented as walls involved, rim involvement, entrapment of soft tissues or extraocular muscles, other sinus involvement, orbital emphysema, and other findings. And the treatment we have given were medical and surgical. Medical management included observation under cover of systemic antibiotics and anti-inflammatory drugs. For patients with no functionally limiting diplopia, negative FDT, cosmetically accepted enophthalmos, and no entrapment of muscle or soft tissue. Well, surgical management was indicated for patients with functionally limiting diplopia, positive force reduction test, significant enophthalmos, and CT scan evidence of large fracture or muscle entrapment. And this management was orbital wall reconstruction with titanium mesh. And the observation and results included most of the cases fall in the age group between 20 to 30 years, and males were more common than females, and unilateral involvement was more common than bilateral, while road traffic accident was the most common mode of injury and assault being the least, and closed globe injury was more common. Conjunctival involvement, subconjunctival hemorrhage was the most common manifestation, and epithelial defect was the most common corneal manifestation, and scleral involvement in the form of scleral tear is seen only in 2 cases. While coming to the walls involved, orbital floor was the most common involved wall, and the least one is the roof. Anterior chamber involvement, vitreous was seen in anterior chamber in 1 case and a gross hyphema in 2 cases. Most common lens manifestation is the subluxation of lens. And lid involvement in the form of periorbital edema is seen in 100% of the cases, and symptoms restriction of eye movements in 6 cases and diplopia in 5 cases. The most common nerve to be involved is the infraorbital nerve, and the next one is optic nerve. Well, coming to comparison with other studies, our study shows that 46% of the cases fall between 20 to 30 years, while Elizabeth Chiang et al. Study shows 31.6% were between this age group. And then walls involved, most common is floor with 50% and least is 8% roof, while Elizabeth Chiang et al. Study shows almost similar. And gender distribution, 80 cases were male and 80% cases were male and 20% female, which is almost similar to the Stephen Terrell et al. Study. Mode of injury, RTA was the most common with 65% of cases, while Michael E. Rosser et al. Study shows 72.25% orbital wall fractures cases were due to RTA. And laterality, bilateral ocular involvement was seen in 10% of cases in our study, while Heidi-Elsman study shows that 2% had bilateral ocular involvement. So the final summary is commonest age group is young males 20 to 30 years, and RTA most common mode of injury, unilateral more common than bilateral, closed globe injury more common than open globe, multiple orbital wall fractures more common than isolated wall fractures, floor of orbital wall was most commonly involved, infraorbital nerve is the most common nerve involved, and posterior segment involvement was relatively less when compared to anterior segment. And as you see, periorbital edema and ecchymosis was seen in 100%, that is 40 cases in our study, and 2 cases had sclerocorneal tear with hyphema, while multiple orbital wall fractures are the most common when compared to isolated. And among walls, it is floor which is most commonly involved. My conclusion is this study helps for better understanding of common ocular manifestations in different types of orbital wall fractures, early diagnosis, treatment, referral that aids in better visual outcome with early interventions. It enumerates the various grievous injuries that are associated with orbital wall fractures and poor visual outcome that can be associated. And road traffic accident being the most common cause, strict road traffic regulations must be followed, and the general population must be made aware of the preventive measures. My references, and thank you.
Nice presentation. So did you, for floor fractures or any other implants?
Titanium mesh was the one which is available in our hospital, madam. With that, we have done orbital wall reconstruction.
Floor?
Floor also titanium.
Titanium.
Silicone. With yes, ma'am, titanium.
Thank you.
So thank you everyone. We end our session here. So congratulations to all the postgraduate who presented today. Just one thing I wanted to tell all of you, that you can make the presentations better, the slides, the way you include the photos. So it will be a good idea when you are in this conference seeing other presenters present. See how they are enlarging the photographs, how there is minimum content in each of the slides. So many of you were reading from the slides, like you have written for 4 or 5 lines on the slide. So that is not the best way of doing it. Like, keep minimum content. It should be visual, like the photographs and all should be magnified, and content wise it should be just pointers there on which you should speak. It shouldn't be the entire line written there and you reading out from the same.